A woman named Josephine came to see me about 4 years ago, and she was genuinely confused, almost hurt, by what her own body was telling her. She'd been walking every single morning for over a year, proud of herself for finally sticking with an exercise routine at 66 years old, and yet her knees hurt worse than before she started. Her lower back ached by afternoon, and she was more tired at the end of the day, not less. She looked at me and said, "Doctor, I did everything right. Why is my body punishing me for trying?" I want to tell you what I found when I actually watched her walk across my office that day, because it wasn't her age. It wasn't her knees failing her. It was something almost nobody ever explains to people over 60, and by the end of this video, you're going to understand exactly what I mean. My name is Dr. Anderson Coco. I've spent nearly 20 years working with seniors here in Virginia, and walking is a topic I return to again and again in my practice, because it sits at this strange intersection of being the single most accessible exercise available to almost everyone, and also one of the most commonly done incorrectly in ways that quietly work against the very health you're trying to protect. Today, I want to walk you through, no pun intended, exactly what I look for when a patient like Josephine tells me walking isn't helping the way it should, and exactly what I recommend instead. Let's start with why this actually matters so much specifically after 60, because I think understanding what's happening inside your body makes every piece of advice that follows make a lot more sense. After the age of 50, and continuing steadily through your 60s, 70s, and beyond, your body goes through several predictable, well-documented changes. The first, and one I talk about often, is a gradual loss of muscle mass, a process doctors call sarcopenia. On average, adults lose somewhere between 1 and 2% of their total muscle mass every single year after 50, which might sound small, but compounds into something quite significant, roughly 15 to 20% of your total muscle over just 1 decade if nothing is done to counteract it. And muscle isn't only about strength for lifting things. It stabilizes your joints, helps regulate your blood sugar, supports your posture, and plays a central role in your balance while walking. The second change involves your joints specifically. The cartilage that cushions the ends of your bones has no direct blood supply of its own, which surprises a lot of my patients when I first explain it. Instead, cartilage receives its nutrition almost entirely through movement itself, specifically through synovial fluid, the natural lubricant inside your joints, being pushed into the cartilage tissue as you move. Without regular, consistent movement, that cartilage essentially goes hungry, gradually thinning and losing elasticity over time, which contributes to the kind of joint stiffness and eventual osteoarthritis so many of my patients associate simply with getting older. The third change is a gradual slowing of your metabolism, roughly 2 to 3% per decade after 50, meaning the exact eating and activity pattern that kept your weight stable in your 40s will often lead to gradual weight gain in your 60s. Not because you did anything wrong, but because your body's baseline energy needs have genuinely shifted. And the fourth change involves circulation, as blood vessel walls gradually lose some of their natural elasticity and peripheral blood flow, particularly to your legs and feet, becomes somewhat less efficient. This is part of why so many of my patients over 60 mention cold feet, occasional nighttime leg cramps, or a heavy, tired sensation in their lower legs by evening. Here's the encouraging part, and it's exactly why walking deserves the attention it gets. Walking meaningfully addresses all 4 of these changes simultaneously. It activates and helps preserve muscle. It nourishes joint cartilage through movement. It supports a healthier metabolic rate. And it improves circulation throughout your entire body. Research consistently associates regular walking with meaningfully lower rates of heart disease, type 2 diabetes, osteoporosis, and even cognitive decline in adults over 60. This isn't a minor feel-good habit. It's genuinely one of the most protective things available to you, and it costs nothing beyond a decent pair of shoes. But, and this is exactly what I needed Josephine to understand that day in my office, all of that benefit depends entirely on walking in a way that actually works with your body rather than quietly against it. Walk the wrong way consistently, and you don't simply get a smaller version of the benefit, you can genuinely create new problems layered right on top of whatever brought you to walking in the first place. Let me walk you through what I actually found wrong with Josephine's routine and the broader patterns I see again and again in my own patients, because I'd be willing to bet at least one or two of these apply to you right now, even if you've been walking faithfully for years. The first issue, and one of the most common I see, is starting a walk at full pace immediately, right out the front door. It feels efficient, almost like why waste time easing into something you could just start doing at full speed. But your body genuinely isn't built that way. When your muscles are still cold, they're less elastic, which increases the risk of tiny microscopic tears in the muscle fibers, individually harmless but capable of accumulating into real, chronic discomfort over months of repeated strain. Your joints haven't had a chance to properly lubricate yet either, since synovial fluid needs a few minutes of gradual movement to distribute evenly across the joint surface rather than sitting pooled in one section the way it does while you're at rest. And your cardiovascular system hasn't adjusted yet, meaning a sudden jump to full intensity causes your heart rate and blood pressure to spike more sharply than necessary, putting avoidable extra stress on blood vessel walls that, after 60, have already lost some of their natural elasticity. The fix costs you absolutely nothing in terms of time. Simply spend the first 3 to 5 minutes of every walk moving deliberately slowly, almost leisurely, before gradually picking up your normal pace. That short window allows your joints to lubricate properly, your muscles to warm, and your heart to settle into a working rhythm before you ask more of it. The second issue is posture, and honestly, this was Josephine's single biggest problem. When I watched her walk across the room, her head was jutting slightly forward, shoulders rounded down, eyes cast toward the ground a few feet ahead of her feet. I want to explain the actual mechanics here, because once you understand the numbers, I think it becomes impossible to unsee in yourself and in others. An average adult human head weighs somewhere around 11 pounds. When it sits properly balanced directly over your spine, your neck muscles carry roughly that 11 pounds. But when your head shifts forward by even an inch or so, which happens naturally when you're looking slightly down while walking, the effective load on your cervical spine increases to roughly 3 times that weight. Shift forward a couple of inches, and that load can multiply 4 to 5 times over, meaning your neck and upper back muscles are effectively supporting somewhere between 45 and 55 pounds continuously throughout your entire walk. Do that for 30 minutes most mornings, and it's not hard to understand why so many people finish a walk with a tight, aching neck they assume is simply age or a draft, when it's actually a straightforward, correctable posture issue. There's a second consequence to this same forward head posture that I think matters just as much. When your chest is compressed and your shoulders are rounded forward, your diaphragm, the primary muscle responsible for breathing, can't fully descend and expand the way it should. Your lungs don't get the chance to properly fill, and you end up breathing shallowly, using only the upper portion of your chest capacity. Less oxygen intake means less available energy for your muscles and your brain during that same walk, which is part of why some people finish a 30-minute walk feeling as exhausted as if they'd walked for an hour, and quietly blame it on their fitness level or their age, when posture is often the real, correctable culprit. Here's what I taught Josephine to do instead, and it's what I recommend to every patient I see with this exact pattern. Imagine a gentle thread attached to the very top of your head, lightly pulling you upward, not in a stiff, military way, just enough to let your spine naturally decompress and lengthen. Let your shoulders relax and settle slightly back, rather than rounding forward. Keep your eyes forward toward the horizon rather than down at the pavement immediately in front of your feet, with your chin roughly parallel to the ground. In this position, your lungs can expand fully, your neck carries its intended, comfortable load rather than an exaggerated one, and your entire spine distributes weight the way it was actually designed to. The third issue involves footwear, and it's genuinely one of the most overlooked pieces of this entire puzzle. 2 specific age-related changes make proper walking shoes far more important after 60 than they were in your 30s or 40s. First, the natural fat pads on the soles of your feet, which act as shock absorbers with every step, gradually thin out over the years. That means your shoes need to compensate for cushioning your body once provided naturally. Second, the muscles and ligaments supporting your foot's arch can weaken over time, sometimes leading to what's called acquired flat foot, which changes the entire angle of load traveling up through your knee, hip, and lower back with every single step. When I recommend walking shoes to my patients, I look for a few specific things: adequate cushioning in both the heel and the front of the foot, soft enough to genuinely absorb impact, but not so soft that your foot sinks without proper support underneath it. Real arch support, meaning the shoe's inner shape follows your foot's natural structure rather than forcing a flat, rigid platform underneath it. And a sole that remains flexible specifically at the front of the foot, since your foot needs to bend naturally at the ball with each step. And an overly rigid sole disrupts that natural heel-to-toe motion, placing unnecessary strain on your calf muscles and Achilles tendon. I also want to mention something practical that surprises a lot of my patients. Shoes can look perfectly fine on the outside while the internal cushioning has already broken down significantly. If you walk regularly, I generally recommend replacing your walking shoes roughly once a year, even if they still look presentable, simply because the shock-absorbing material inside tends to wear out well before the shoe's exterior shows any sign of it. The fourth issue is a pattern I see constantly, especially in patients who consider themselves reasonably active. Walking rarely, but for a long stretch when they finally do, often just one longer walk over the weekend, an hour or more, and considering that sufficient for the entire week. I understand the appeal. It feels efficient, and it genuinely does feel like a real accomplishment in the moment. But physiologically, your body doesn't respond well to isolated bursts of activity separated by days of complete rest. It responds to consistent, repeated signals. Every time you walk, you're sending your cardiovascular system, your muscles, and your metabolism a clear message that regular movement is simply the norm, and your body gradually adapts in response, becoming more efficient over time. A single walk once a week is too weak and too infrequent a signal for that meaningful adaptation to actually occur. Worse, that one long walk, coming after days of inactivity, places real sudden stress on muscles that are essentially unprepared for it, which is exactly why so many people feel sore and stiff the following day and quietly conclude walking simply isn't right for their body, when the real issue is the pattern, not the activity itself. What I recommend instead, based on both the research and what I've consistently seen work well for my own patients, is 20 to 30 minutes of walking on most days of the week, 5 or 6 days, rather than one long session. If that feels like a significant jump from where you currently are, there's no shame at all in starting smaller. Begin with 3 shorter walks a week, even just 10 minutes each, and gradually add a few minutes every couple of weeks as it starts to feel comfortable. Gradual, consistent progression isn't a weaker approach. It's genuinely the more effective strategy for lasting results. The fifth issue involves your arms, which most people never think about at all while walking. Many people either keep their arms rigidly at their sides, let them hang completely motionless, or tuck their hands into their pockets. It feels comfortable enough in the moment, but it quietly strips away a meaningful portion of walking's overall benefit. Walking naturally involves a cross-body coordination pattern, where your left arm swings forward as your right leg steps forward, and vice versa. This pattern is genuinely hardwired into your nervous system, and it helps distribute loads symmetrically across your spine while reducing unnecessary rotational stress on your torso with each step. When your arms stay still, your spine has to compensate for that asymmetry, often through subtle over-rotation in your lower back, which can be a real problem for anyone already managing lower back discomfort. Beyond that, natural arm movement engages the muscles of your shoulders, chest, and upper back, meaning a walk with proper arm swing genuinely activates more total muscle mass than the same walk with static arms, translating into better circulation and a more meaningful metabolic effect from the exact same distance covered. The fix is simple. Bend your elbows slightly, somewhere around 90 degrees, and let them swing naturally forward and back in rhythm opposite your legs. You don't need the exaggerated pumping motion of competitive race walkers. Just genuinely stop pinning your arms motionless against your body. The sixth issue is one that's become far more common in recent years, and it's walking while looking down at a phone. I understand the appeal completely, checking messages, listening to something, feeling like you're multitasking productively. But I want to walk you through exactly why this matters more than people realize, especially after 60. First, everything we just discussed about posture becomes significantly worse because looking down at a phone held in front of you, or worse, down near your waist, tilts your head forward even more dramatically than ordinary poor posture alone, multiplying that neck load I described earlier even further. Second, and this is the piece I really want you to hear, after 60, your vestibular system, the balance and orientation mechanism located in your inner ear, along with your proprioception, your body's internal sense of its own position in space, both naturally become somewhat less precise with age. This means your brain increasingly relies on visual information from your surroundings to help maintain steady balance while walking. When your eyes are locked on a screen instead of the path ahead of you, your brain is deprived of exactly the visual input it needs most, and you become genuinely more likely to miss an uneven section of pavement, a curb, a small step, or a wet patch, meaningfully increasing your risk of a fall. And a fall after 60 carries real weight, sometimes literally resulting in a fractured wrist or hip, injuries that can mean extended immobility, surgery, and a lengthy recovery process. My advice here is genuinely simple. Keep your phone in your pocket during your walk. If you enjoy listening to music or a podcast, that's completely fine. Use earbuds, but keep the screen itself out of your hands and your eyes on the path ahead. The seventh issue, and one almost nobody ever discusses, is skipping recovery entirely after a walk, because walking feels gentle enough that surely no recovery is necessary. That assumption isn't quite accurate. Your muscle tissue is roughly 70 to 75% water, and nearly every biochemical process involved in muscle contraction, relaxation, and repair happens within that watery environment. Even mild dehydration, just a small percentage reduction in your body's fluid levels, measurably reduces muscle elasticity and can meaningfully increase your risk of cramping. A simple glass of water after your walk genuinely supports that recovery process. Beyond hydration, your muscles work in a repeatedly shortening motion throughout a walk, and without some gentle stretching afterward, they tend to remain slightly shortened once you stop, which accumulates over time into genuine tightness and reduced joint range of motion, particularly in your calves, the backs of your thighs, and your lower back. Just 5 minutes of gentle stretching after each walk goes a long way toward preventing that gradual stiffness from building. And finally, rest days genuinely matter here too. Your body doesn't actually adapt and strengthen during the activity itself. It adapts during the recovery period afterward, when muscle fibers repair and reinforce themselves and your cardiovascular system adjusts to handle its new baseline demand. 1 or 2 rest days each week isn't a sign of laziness. It's a legitimate, necessary part of the overall process. Now, I want to come back to Josephine because I think her story genuinely illustrates how much of a difference correcting these patterns can make. When I watched her walk, she had essentially every one of these issues layered together. She started at full pace immediately. Her posture had that forward head tilt. Her walking shoes were nearly 3 years old with worn-out cushioning she hadn't thought twice about, and she was walking her one long weekend route while barely moving the rest of the week. We worked through each piece gradually over about 6 weeks, starting slow for the first few minutes of each walk, consciously adjusting her posture, replacing her shoes, spreading her, walking across 5 shorter sessions rather than one long one, and adding that brief stretching routine afterward. She came back to my office roughly 2 months later and told me, almost surprised at herself, that her knee pain had genuinely improved. Her energy afterward felt completely different, and walking finally felt like something helping her rather than something she was quietly enduring. I want to mention something important here too, because context matters, and I never want to give guidance without acknowledging real individual variation. All of these adjustments carry meaningfully more importance the older you get. The consequences of poor posture, worn-out shoes, or skipped recovery tend to be roughly 2 to 3 times more significant after 60 than they were at 30, simply because the natural resilience of your joints, blood vessels, and muscles gradually decreases over the years. A habit your body might have easily absorbed without consequence decades ago can genuinely produce real, noticeable symptoms now, which is exactly why I think this topic deserves far more attention than it typically gets. If you're finding this helpful, please take a moment to hit that subscribe button, because every single week I bring you exactly this kind of practical, real guidance grounded in nearly 2 decades of hands-on clinical experience with patients exactly like you, not generic advice, but the specific patterns I actually see and correct in my own practice. And I'd genuinely love to hear from you in the comments. Tell me, did you recognize any of your own walking habits in what I described today? I read every single comment, and honestly, stories like Josephine's are exactly the kind of thing that shapes what I choose to cover in future videos. Let me leave you with a clear, practical summary before we wrap up today, because I want you to actually be able to use everything we've covered, not just nod along and forget it by tomorrow morning. Start every walk with 3 to 5 minutes of genuinely slow, easy movement before picking up your normal pace. Check your posture before you even step outside, imagining that gentle thread lifting the crown of your head, shoulders relaxed and slightly back, eyes on the horizon rather than the pavement. Look at the soles of your current walking shoes, and if they're worn unevenly or you've had them for more than about a year of regular use, it's genuinely worth replacing them. Spread your walking across 5 or 6 shorter sessions through the week rather than one long weekend walk, starting smaller if needed and building gradually. Let your arms swing naturally in rhythm with your steps instead of holding them still. Keep your phone in your pocket for the full walk, and if you want audio, use earbuds instead. And afterward, a glass of water and about 5 minutes of gentle stretching, a small habit that meaningfully protects you from the chronic stiffness that builds up so quietly over months and years. Walking remains one of the safest, most accessible, and genuinely effective tools available to you for protecting your health after 60. You don't need a gym membership, expensive equipment, or any special preparation. What you need is simply the right habits and a bit of conscious attention to how you're actually doing it. And small, correctable adjustments like the ones we've covered today can produce real, lasting benefits for your heart, your joints, your balance, and your overall sense of well-being. So here's my challenge for you this week. On your very next walk, try just 2 of these adjustments, maybe the slow start and the posture check, and pay attention to how your body feels afterward compared to usual. Give it a genuine, honest week, and notice what changes. If you want more of this kind of clear, practical guidance made specifically for people navigating exactly what you're navigating right now, make sure you're subscribed, and I'll see you in the next video, where we're going to talk about something else that quietly shapes how well you age, something most people never think to ask their doctor about directly. Take care of yourselves, and I'll see you soon.